Hi, it's Dr. Centeno, and today we're going to talk about some really interesting things with bone marrow stem cells and how they can help repair damaged muscle. Now, everyone tears muscles from time to time, and sometimes they just don't heal. Hamstring injuries are notorious for that, rotator cuff tears, etc. Now, can stem cells help that in any way? Well, there are three main stem cells in bone marrow: mesenchymal stem cells, which help for cartilage repair, tendon, ligament, that sort of thing, and endothelial progenitor cells, which create new blood supply, which is critical in repairing tissue. And there are also something called hematopoietic stem cells. They're also involved, curiously, in muscle repair. So, how does that work? How can this stem cell that's normally responsible for creating new blood help repair damaged muscle? Well, mature muscle cells are pretty much done dividing. So they have to be able to adapt in other ways. And if one gets damaged, there has to be a way to replace it. And that's done by the satellite cells. So when there's a dead muscle, it sends out a signal. The satellite cell comes on in and copies itself. It sends one of those copies into the repair area. And then once it's there, it simply differentiates into the type of muscle cell that's needed in that area for the repair. Now, as you get older, there are fewer and fewer of these satellite cells around to help muscles repair, and that's an issue. When there are no satellite cells left, however, your body has figured out how to get bone marrow stem cells to do the same exact job. So your body sends in a bone marrow stem cell. It then takes the place of the satellite cell and differentiates into a new muscle cell. But when there's poor muscle blood supply, which is common in aged and degenerated muscles, the bone marrow stem cells can't reach that damaged area, and basically they just sort of go on by. Now, this is where injecting HSCs into the area can come in handy to aid muscle repair, which is what we do in a precise stem cell injection. So in summary, we have fewer muscle repair stem cells as we age. Usually the bone marrow hematopoietic stem cells come to the rescue, but in areas of muscle with poor blood supply, those hematopoietic stem cells or HSCs can't get there to help. And that's where injecting bone marrow stem cells into the area under precise ultrasound guidance can make a big difference for many patients.